Hello, everyone. My name is Rithika Karthikeyan, and today I want to talk about lung cancer and how single-cell RNA sequencing techniques can be used to combat disparities in diagnosis. Lung cancer is one of the most devastating cancers globally, with over 2 million new cases each year. And the unfortunate reality is that there are disparities in the way that lung cancer is diagnosed and treated. Socioeconomic status, access to healthcare facilities, education, and the geographic distribution of healthcare resources are all factors that can impact your quality of healthcare. So understanding these disparities and how we can fix them is incredibly important to public health. But before we dive in, let me give you a brief bio about myself. I'm a rising senior and IB diploma candidate at the International Academy East in Troy, Michigan. I'm also an aspiring healthcare professional and engaging myself in advocacy efforts through organizations like the National Honor Society, student government, and National Equity Project have really allowed me to discover the issues that I'm passionate about, like improving access to healthcare and making quality education accessible for all. I've been able to further these passions and build a network of like-minded, driven peers by competing in Science Olympiad, HOSA, and forensics, among other competitions. I'm excited to share my passion for healthcare advocacy with you all today and take a closer look at an issue that impacts people around the world: disparities in diagnosis of cancer. So today we'll take a look at what I mean when I say disparities in diagnosis, see why that's a global concern, and then zoom in on one proposed solution, as well as its potential impacts, through the lens of research that I conducted this past fall. On the screen here are two maps, and the one on the left shows the number of individuals who have died of lung cancer, where darker regions indicate more deaths, and the map on the right shows the Human Development Index levels for each country, where darker regions indicate lower levels. So it's easy to see that in many countries, a lower HDI level means more mortalities, especially in South America, Southern Europe, and Africa. And you might be wondering what this has to do with lung cancer specifically. Well, in areas where HDI levels are lower, typically rural areas, there are fewer cancer prevention efforts and there's less advocacy in general for healthcare. People in these areas often experience a poor quality of life. And because they don't have much access to education that teaches them not to come in contact with carcinogens and to wear sunscreen, we often see more cancer cases develop. These disparities continue into the diagnosis and treatment phase because these individuals often have less access to healthcare resources and can't seek a diagnosis or treatment soon enough. As we'll see in more detail later, an early diagnosis is often the first step in creating a good prognosis for the patient. Poor healthcare infrastructure also means that the patient's quality of treatment will be lower, and that they might not have access to the necessary medications or facilities. Finally, this leads to a higher mortality rate because the patients that received a late diagnosis did not have access to the right treatment, and because of that, they had a poor prognosis. As you can see, differences in the resources available really does have an impact on the way that cancer develops and is treated in underserved regions around the world. And because this has such an impact on the international community, we can classify it under the umbrella of global health. So here are a few statistics that will help us understand the global burden of lung cancer and why early diagnosis is so important. About a fifth of lung cancer-related deaths could be prevented if the patient was diagnosed earlier. And for the patients who are diagnosed early enough, more than half die within a year of being diagnosed. That's really significant because it means the window for diagnosis and treatment is less than a year after the onset of symptoms. Adding on to that, the 5-year survival rate drops nearly 50% if the cancer is not diagnosed and treated early enough. So it's clear here that an early diagnosis is crucial to patient well-being and for their outlook. And based on the maps that we took a look at earlier, it's also clear that the current diagnostic treatments, such as radiography scans, aren't distributed well enough or made accessible enough for underserved populations. Recently, I did some research on the technology of single-cell RNA sequencing, or SCRNA sequencing for short. And I looked for biomarkers that indicate the presence of lung cancer by comparing the genetic code of cancerous and non-cancerous tissue samples. In essence, researchers isolate individual cells, lyse them to extract their genetic material, and then use PCR, or polymerase chain reactions, to amplify or essentially make many copies of the DNA. After this step is where my research began. I used DNA from the National Institutes of Health, where the DNA was sequenced and read. Using computational biology toolkits like ScanPy, I then analyzed the levels of expression for certain genes and identified potential biomarkers. In the context of lung cancer diagnoses, SCRNA sequencing can be used to identify genes of interest, analyze levels of expression, evaluate the function of those genes in the context of lung carcinomas. And once researchers have determined that a particular biomarker is a strong indicator of lung cancer, it can be used in diagnostic screening. Biomarker and scRNA-based screening for lung cancer can be really effective in improving diagnosis rates because they're a lot more accessible. For traditional methods, such as radiography scans, the patients need to be brought into a radiology center and screened, and that might not be accessible for individuals living in underserved or rural areas. SCRNA sequencing-based screening is a lot more effective because physicians just need to collect tissue samples from where the patients are located and then can transport those samples to a laboratory elsewhere for testing. This is a lot more geographically accessible for patients, and because of that, more individuals will have the opportunity to be screened for lung cancer. To make this even more accessible and cost-effective, researchers can develop an AI-based model to analyze the sequencing data and provide a potential diagnosis. Here are my references. And I'd like to end with a few words of thanks. Thank you so much to my family, teachers, and mentors who have provided me with guidance and helped me find my passion for healthcare. A huge thank you to the GHLC at Johns Hopkins University for giving me the platform to speak about this important global health issue. And lastly, I'd like to thank you all for your time and attention. Here are my contacts if you'd like to work with me on a project or hear more about my work. I'm always looking to support advocacy and public health initiatives, so feel free to reach out via email or LinkedIn. Once again, thank you all for your time.